all of us we know about the infertility. Yes. So that is at first the definition. Everything we need to know the definition properly. Here infertility, another term is subfertility, another is sterility, and infertility primary and secondary also. So infertility is the inability of a couple to conceive within 1 year of unprotected coitus. That's the definition. Inability of a couple to conceive within 1 year of unprotected coitus. That is, they are active, sexually active within 1 year, should stay together along, and if unable to conceive, then it is called infertility. So for infertility, sterility is the term that is absolute term, that is not possible at all. But so the word, another word is subfertility, as when one couple is infertile and after some period of time spontaneously conceive or conceive after some treatment. So the term use subfertility, subfertility. So if we go about the infertility, incidence is quite high, 10 to 12% of the marital women that is infertile. So it is high, incidence is high. So for infertility, when we see the causes, so at first we know how the conception occurs. So regarding conception, all of us we know we need spermatozoa and the ovum and meeting with the proper area and then development. So we should know about these two factors. So the male factor, female factor, sometimes we do not find any cause. Sometimes we do not find any cause. That is unclassified or unexplained. Unexplained. That is another term. Unexplained. So if we come to the spermatozoa, why it is formed? In the testes. So problem in the testes and the pathway like the ductus deferens or ejaculatory ducts and somewhere problem, and then the total process of the that is fertilization that is affected. So if within spermatozoa, so testis problem. So if within the testis, testis is maybe affected, testicular failure. Testicular failure কোথায় কোথায় থাকতে পারে? Number one is hypoactive, by the affecting of the some hormonal problem. Hypoactive like undescended testis, incomplete development, undescended testis. You know the undescended testis sometimes it is in the incomplete descent also. Then if it is in the abdominal cavity, by the abdominal temperature, intra-abdominal temperature, it is the testis is destroyed. So there is a problem in case of the undescended testis. Okay, then after testis, it goes to the ductal system. It enters, the spermatozoa enters into the, here so many factors, some drugs, some hormone, suppose hyperprolactinemia, radiation, infection, that is orchitis, you know the term orchitis. So it all can affect this testicular function, okay? And then come to the duct system. Duct, you know the vas deferens. Vas deferens, that is duct may be obstructed by somehow. infection, following infection, or some following some surgery for hydrocele, varicocele, or some herniorrhaphy. This may cause affect the bus difference. And then ejaculation problem. If there is sexual problem, ejaculation problem, then also it may be affected. Okay. Now come to the ovary. Ovary, how it can be affected? Ovarian. Ovary, how can it be affected? Ovarian failure, there is no anovulation. Most important time is anovulation. No ovarian, that is ovulation. That is called anovulation. So many factors for the anovulation. And then luteal phase deficiency. That is luteal phase deficiency. Luteal phase deficiency. And for ovulation, so many things are responsible. And after ovulation, it enters into the fallopian tube. So after that, peritoneal factors. Peritoneal factors. Then tubal factors. Peritoneal factors, then tubal factors, then ultimately where it comes to the uterine. So uterine factor, mostly these are. Okay, so what are the causes of anovulation? What are the causes of anovulation? So many causes. It is hormonal. Most common is polycystic ovarian syndrome. Then others is chromosomal abnormalities. Turner syndrome like this, chromosomal abnormalities. Then hormone is hyperprolactinemia. And hypothyroidism, hypothalamus disorder, hypothyroidism, and hypothalamic function disorder. For the ovulation, what are in ovary? What are the hormones? That is hypothalamus, then pituitary gland, then ovaries. From hypothalamus, what hormone comes? From hypothalamus, Gynae, and pituitary, FSH and LH. So in this part, if anywhere it is affected, then ovarian function also affected. Okay, so these are the important causes of the anovulation. Anything? Hyperprolactinemia, Gynae affected FSH. If pituitary hypofunction or pituitary failure, then also it is affected. These are the most common. And hormonal assay, if we suspect from the history, that is then most of that preferable time is 2 to 5 days of the menstrual cycle. In this time, 2 to 5 days, we assess the hormonal study. Now, what are the uterine factor? Uterine factor, uterus absent, like Mullerian agenesis, and hypoplasia uterus, then synechiae, the Aswmc syndrome, like this. Then other abnormalities in the uterus, it is also affect the fertilization, that is conception. Okay, now we can come to the how can we assess the infertile couple? That is important. Okay, assessment. assessment now, if we think assessment is so important, patient usually comes to the history of the inability to conceive. So how can we assess the patient? How can we assess history? At first, history taking in details, marital age, sexual function, and any drug history, treatment history, surgical history, everything we should know. And at first we take the history individually. At first the female and then male, and then combined separately. There may be some confidential things, so we should take the history separately and then combinedly, and then we examine the patient. What we examine from general examination up to per abdominal examination and per vaginal examination, all we should examine, and all through individual management. It is we need to suspect or we need to assess the actual cause of the infertility. So from history, examination and evaluation, and we should think what are the possible causes of the infertility. So many investigations for the infertility, so many investigations. So we should not do every investigation for every patient. So we should evaluate what is the possible factors for the infertility.